Good afternoon, everyone. We're excited to be with you all today at our second of our educational series, SmartHeart Educational Webinar Series, Mind Over Matter, the Impact of Stress and Mental Health on Your Heart. I am joined by the esteemed Dr. LaToya Linton-Frazier. Dr. Frazier, this is her second webinar with us. And we had a conversation last time about the impact of stress and mental health on your heart. And we thought that would be a great topic to cover here with many of our subscribers and the people just interested in the topic of the impact of mental health on your heart. So Dr. LaToya Linton-Frazier graduated with her medical degree from Penn State, and she's been in clinical practice for the past 13 years. With a specialty in mechanical and pharmacological treatment of heart rhythm disorders, including pacemaker and ICD implantable devices, and the use of medications to control abnormal heart rhythms. She also practices telemedicine for Heart Nexus, which is the cardiology practice that provides telemedicine and ECG interpretations for SmartHeart. So we thought this would be a fantastic topic to cover in this second webinar with you all. Because not many people understand the pivotal relationship between cardiovascular disease, stress, and mental health. And there was a recent study about anger and the impact that just anger can cause on your heart. And we'll get into that here as we start the Q&A. So mental health and its impact on the body, and in particular your heart, is often overlooked. And there's a tremendous interplay that I am not versed enough to speak about, but we're lucky enough to have Dr. Frazier here to speak about that interplay between the well-being, your well-being and emotional well-being, and cardiovascular health. And despite all of the advancements that we've made over the years with medications and devices and access to telehealth, cardiovascular disease, as we know, remains a global health challenge. And so there's an urgent need to put a comprehensive approach to this multifaceted disorder. And we're excited to have Dr. Frazier join us and answer a few questions. At the end of the webinar, or even during, there's an opportunity for anybody that's in attendance to put a question in the queue. At the bottom of your screen, in the middle of the screen, there's an option to hit Q&A. And we will do our best at the end to get through those questions. This Q&A session should be about 25 minutes, and we'll leave 10 to 15 minutes at the end for any audience submitted questions. So welcome, Dr. Frazier. It's great to have you here.
Thank you, Jason. Pleasure's mine.
So I wrote a few questions down for you, and I'm really looking forward to hearing what you have to say. The first one I have here is coronary heart disease and mental health, as we know, are among the leading causes of morbidity and mortality worldwide. As we've discussed, decades of research have revealed several and sometimes surprising links between heart disease and mental illness, and even suggested that one can cause the other. Can you explain the role mental health disorders like anxiety and depression play in the development and progression of cardiovascular diseases?
Yes. So mental health disorders and cardiovascular disease, as you said, great interplay. It's actually a pretty complex relationship, and in fact, bidirectional, meaning patients who already have existing cardiac issues can certainly develop stress and anxiety related to that. In addition, patients with mental health disorders also develop cardiac diseases. So being that it is both complex and bidirectional, there are a few manifestations that we see. One is the physiological effect. So in states like depression and anxiety, what the body does is that it releases stress hormones, cortisol, adrenaline, and those hormones tend to keep the heart rates high, kind of get the system revved up. And so over time, chronic elevation in heart rate can certainly lead to cardiac arrhythmias or abnormal rhythms, coronary artery disease, or narrowing of the arteries, in addition to hypertension. In addition to the physiological effect, we also see that individuals that are prone to having mental health disorders oftentimes have unhealthy coping mechanisms. So, for instance, they'll indulge in dietary indiscretion. They're eating less heart healthy diets. They're consuming alcohol. They tend to smoke, or they tend to not have self-care. That in itself can lead to worsened heart disease. We also see impact on lifestyle. Individuals with mental health disorders tend not to have appropriate sleep patterns. Again, having a sedentary lifestyle and not, engaging in diet and exercise, all of those factors help to advance and play a negative role in cardiac diseases.
So it's like this doom loop that we get ourselves into. And I know over the last 4 years, and maybe even since the dawn of social media, there's a lot of research now about the impact of social media and our mental health. And if you get into that state, it's certainly difficult to get out of it. Sometimes you get in a rut. And so now that we know that stress is a risk factor for heart diseases and cardiovascular diseases in particular, if people don't manage stress and the long-term effect, what are the long-term effects of mental health disorders? What actually does it cause? What happens when you have long-term stress, long-term anxiety, long-term mental health disorders that causes this progression of cardiovascular diseases?
Right. So again, like you said, it's a cycle, and it's an ever dooming cycle. So with untreated anxiety and stress, the physiologic effects that we see on the body, particularly the heart, we have instances where the blood pressure increases, again, from the stress release hormones. And so chronically elevated blood pressures tend to cause end organ damage. So we can see insults to the heart itself, the kidneys, the eyes, poor sleep pattern, obstructive sleep apnea, diabetes. So just a negative effect overall. With stress and anxiety and depression, we also see a correlation of a high inflammatory state. High inflammatory states have been correlated to the progression of atherosclerosis, which is a hardening of heart arteries, thus making it a higher chance of having coronary disease, which certainly could translate into having a myocardial infarction. Unhealthy coping mechanisms is probably one of the biggest things that we often see with the interplay between cardiovascular disease and mental health. Like I said, not taking care of the person, him or herself, indulging in poor habits, whether it's tobacco use or excessive alcohol consumption, and even getting to the state where the individual is not taking their medications, which we've seen time and time again that certainly could be detrimental.
So when you think about, identifying the impact and the long-term impacts of mental health disorders, anxiety, depression, stress on the heart, are there particular subgroups or populations that are more vulnerable than others, maybe, or at higher risk that stress is going to have a long-term impact on their heart health?
Absolutely, a wide variety, and even subgroups that we don't even consider or don't even think about. So those individuals, number one, with pre-existing heart conditions, tend to fare worse if they are plagued with anxiety, depression, post-traumatic stress disorder, because then they get into that rut of not wanting to even follow up with their provider or even taking medications. And so with that chronic release in the stress hormones, keeping the blood pressures high, narrowing the vessels. That's just a vicious cycle that certainly portends a less favorable prognosis for those patients who already have existing conditions. Elderly individuals is another subset that they oftentimes may not be able to cope well with stressors. One, it could be because they don't have any social outlets. They may be by themselves, so they're not easy to adapt to getting the mental health care that they need. And also in our older population, there is certainly a difference in the physiology with the arteries, right? They have less what we call nitric oxide that helps to vasodilate the vessels. So their nitric oxide is lower. So they would be more impacted with stress and anxiety. I will be remiss if I do not mention minority groups, racial and ethnic minorities, or that subset of individuals that are marginalized. There is a high rate of mental health disorders in that population. And with the lack of access to medical care, worrying about financial stability and having food deserts. Again, that cycle is often manifested by not being able to address their cardiovascular needs because they just don't have the wherewithal to do that.
Mm-hmm.
Women in particular is also another subset. There's physiological differences, and we talked about that at the last webinar between men and women, but we're usually, the providers or vessels are smaller. So when we're talking about stress and anxiety, having coming to the table with smaller vessels, we find that hypertension may be a bigger factor for us because we're already starting out with smaller diameter vessels. And then I would be remiss if I do not mention individuals that are in high stressed environments, so healthcare providers, individuals who are in the corporate world have an excess amount of stress. And so we're seeing that their cardiovascular health can also be affected.
It's been really eye-opening introducing this service, the SmartHeart service, to the U.S. Service that's been around for a long time outside of the United States, but we've seen our subscriber base really run the gamut, and you wonder whether or not stress, depression, anxiety plays into quite a few of our subscribers are in their 20s, in their 30s, early 40s. And so many people sort of suspect that, heart disease is a disease of the elderly only, and it's certainly not. And medications, as you mentioned, oddly enough, medications that are given to people for mental health disorders can have a major impact on the heart. Heart disease or medications that are given to people that maybe have been diagnosed with cancer can also have a tremendous impact on the heart. And so we found that it's not just people with heart disease that are subscribing, but maybe there's a family history, or maybe they do have mental health challenges and they're on medications and they're feeling nervous and anxious, and they know their heart is just not beating properly. It's been wonderful to be able to help those people that may have been sort of their signs may have been ignored because they are so young and maybe healthy and vibrant, but the impact of mental health may be driving some of our subscribers to become members. So just considering that, once there's been a diagnosis of cardiovascular disease, and we've talked about the doom loop where that can cause depression and vice versa. Depression and anxiety and stress can cause heart disease. So let's just say there's been a diagnosis of some type of cardiovascular disease, whether that be an arrhythmia or whatever age you might be, a rhythm disturbance, or maybe it's heart disease, early heart disease, or peripheral vascular disease. How do you get checked for mental health so it doesn't become a spiral, and that can be addressed with your primary care, or if you're seeing a cardiologist? Sounds like your dog wants to say something about this.
I know. It must be somebody out there walking. She's a
There's something that's resonating with your dog there. But when you're in the doctor's office and they found an arrhythmia or something, and they need to speak up because we know it can cause depression, anxiety, and stress. How do we advocate and ensure that the doctor is considering, I don't want to be depressed by this because I'm not going to be able to get out of this and take care of my health, because they're going to be feeding off each other.
Right. And that's a good question. And so as healthcare providers, and, again, the first line is probably the family doctor, but then I think patients need to take autonomy when they're having mood disorders, or they're feeling, well, I may not feel comfortable addressing this problem, this issue with my primary care provider, and they may have a better connection with their specialists, or I'm going to put the cardiology hat on. So patients need to seek help. They need to let their primary care or specialist provider know what's going on, because treating mental health disorders certainly will positively impact the outcome with regards to cardiovascular disease. As providers, sometimes, there is that, a 10-minute window to see patients, or 50 minutes. So there is that time limiting factor. But there are simple things that can be done, right? You can have a questionnaire that's given to the patients when they come to their appointment, and all that they need to do is, fill it out, and then a good 2 minutes or so could even be a good starter to address whatever issues. I think that to be effective in total care will take a collaborative approach. So the specialist, as well as a mental health care provider, in collaboration, can certainly make a great impact with the overall outcome. Individuals or patients should also have regular follow-up and regular monitoring, right? So it just depends on what the condition is. I'm going to speak to the medications that you just discussed. There are certain medications that's used for depressions that can certainly cause abnormal rhythms of the heart that are life-threatening: ventricular tachycardia, ventricular fibrillation. And as the specialist, we have patients coming in for routine EKGs, right, with a change in dose, with initiation of other medications. So routine follow-up is certainly a necessity and highly recommended.
Excellent. Yeah, it's interesting because I don't have a cardiologist. I assume at some point I will need to find one. But my primary care physician asks questions about depression and anxiety. Do you have the questionnaire? Do you feel alone? Do you feel? And you tend to brush those questions off sometimes, either because you're embarrassed or you just don't want to get into a conversation about it. But someone like myself who does have high cholesterol and is on a statin, until I started doing the research for this podcast, I knew there was a relationship between mental health and cardiovascular disease, but didn't really understand the interplay and how closely tied they are. So I just encourage our audience to answer those questions truthfully and honestly, because if you don't, and you don't have your mental health addressed along with your cardiovascular disorder, obviously, as we're discussing, both are going to get worse. They're not going to get better. If you address one and not the other, then it's the interplay is so strong that you're not going to be able to get out of the cycle if you don't address both issues.
And that's correct. Yes.
So what's a couple of days ago, and some of our audience might have seen this episode on the Today Show. It's not just stress and anxiety and depression. It's anger. And, I'm sure people have heard stories of heart attacks that occur when someone's in an argument or fight. But recently there was a study that they discussed in the Today Show, and I went back and I read the study, there is a direct correlation between dysfunction of the blood vessels and the impact when people get angry. So this study showed that in a randomized way, researchers asked healthy adults to remember a time when they were angry, anxious, or sad. And they measured the changes in the blood vessel dysfunction. And then they found that when people recalled that moment when they were angry, they had noticeable differences in how their blood vessels functioned. And so it was the first time that there was a direct correlation where there was a measurement of the blood vessel and the impact of just having the thought and not being in that moment of being angry, how that has the effect that that has on your heart. And I know, listen, we all get angry and it's going to happen. But I'd love if you could just elaborate a little bit on the effect of anger and how it affects the heart and the heart rhythm and blood vessels, and maybe what we can do to stop being so angry and depressed.
Well, I would be everybody's hero, right? So anger is certainly a common emotional response. We've all been there. But yes, so there is a physiologic effect that happens to the body with anger. So some of you may have heard the fight or flight response, and that's just a mechanism that we have adapted to keep us safe, right? So, say for instance, we're out in the woods and we see a bear, so we're either gonna run or we're gonna be so scared that we can't do anything. We're just gonna stay put. So this is a mechanism that the body has developed to deal with perceived threats and challenges. So with the fight or flight response during anger, the heart rate increases. So with an increase in heart rate, the blood pressure also increases, and so the release of stress hormones that I talked about, the cortisol and the adrenaline, actually causes the blood vessels to narrow. With the narrowing of the blood vessels, the heart is seeing this great pressure that it has to work against. So narrowing of the blood vessels or vasoconstriction ends up causing increased blood pressures and placing this additional stress on the heart. With that, the narrowing of the blood vessels, as you can imagine, causes impaired blood flow to organs. The heart also feeds itself, so we have impaired blood flow to the heart itself, and so blood takes oxygen, nutrients, all the electrolytes to the heart muscle. So if we can imagine having impaired blood flow to the heart muscle, that can manifest in chest pain, or to the very extent, an acute MI, where the vessels are narrowed to the point where there's no blood flow getting beyond that narrowing. So potentially can lead to what we call ischemia, which is manifested by chest pain or an MI. And in addition to that physiologic effect that we see, we can also see abnormal rhythm. So again, in times of acute anger or chronic anger, heart rates get fast. Sometimes we find that there are abnormal fast rhythms. So like a supraventricular tachycardia, that's just an abnormal rhythm from the top chambers of the heart. Or that there could also be an abnormal rhythm called atrial fibrillation, which some people may have heard, and that is a beast in and of itself that warrants a full discussion. But we tend to see all of these negative um, heart-related issues with anger. And so to mitigate this, right? I mean, we could always say, well, let's not be angry. But again, life is life. So we have to try to, or individuals to try to figure out the triggers. There are coping mechanisms, mindful meditation, just taking some
Exercise.
exercise and taking some time out. Like if you're in the heat of the moment, a quick thing to do is just to stop, count to 10, get the heart rates down, so that you can lower the level of the cortisol release. Um, um, Talk to friends, family, so there are things that we can do to mitigate this.
Excellent. I'm gonna switch up the order a little bit. I think this will be okay with you, even though we had a preliminary discussion about the order of questions. So two good questions came in from the audience, and I want to make sure before we get into maybe how to sort of monitor your heart if you have been diagnosed with a mental health or a heart disease. I just want to ask you two questions that came in from our audience, and they're arrhythmia questions. So we have the perfect guest to answer these questions. So the first one is the connection between mental health and heart disease one causes the other? An example, occasional episodes of AFib. Is this brought on by physical, mental, or both?
That's a very good question, because that's a question I get asked perhaps 3 or 4 times in my clinic. It is multifactorial, meaning, and it's a cycle. So for atrial fibrillation, there is an anatomical substrate. We know there is an area in the heart that causes abnormal firing, that causes AFib. So that's an anatomical substrate. But we've also seen the interplay with stress, with not necessarily depression, and not necessarily with exercise, right? I would say certainly more stress related instances can exacerbate occurrences of AFib. It's not necessarily a cause, meaning not everybody with stress are going to have AFib, but there's certainly a true correlation, and limiting the stressor, finding ways to mitigate the feeling can certainly reduce the AFib burden.
So if you have a diagnosis of atrial fibrillation, and maybe you haven't had an ablation, or maybe it's not being treated pharmacologically yet, or maybe it is, and you still have bouts of AFib, are there any studies showing that if you do manage your mental health, not pharmacologically, but if you took steps like
With
yoga and
cognitive behavior therapy,
meditation and mindfulness, that there's fewer
yeah,
episodes of AFib?
yes.
Yeah,
I don't
yeah,
have
fantastic.
studies off my top of my head, but yes, they have been investigators looking at these social determinants to see if that increases the burden of AFib, and they have found a true correlation.
Yeah, I got to do more meditation. I come in and out of bouts of doing that, and I'm in a period where I'm not doing it as often as I maybe once did.
And it's sometimes not as hard, it's not spending 20 to 30 minutes with a hum, right? I mean, this could even be done as soon as we awake, 2 minutes, 5 minutes of just mindful, quiet and silence. That certainly is additive.
And purposeful breathing, just keep your eyes closed. And
Correct.
the other question is one about menopause, and certainly menopause can cause, there's a lot of different sort of maladies that can spawn from that, and depression and anxiety and stress can be one of them. But in particular, is there a role that menopause plays in arrhythmias that may be overlooked on a comprehensive health evaluation? So you've been evaluated, been diagnosed with menopause, and maybe it's overlooked that menopause has a play with heart disease and arrhythmias.
Right. Yeah, it is not necessarily mainstream or a topic that may be addressed routinely. I have gynecological colleagues that, I've had this discussion with when we talk about HRT or hormone replacement therapy. But certainly with menopause, the change and the interplay with the hormonal levels, that's estrogen, certainly can affect abnormal rhythms. I do have women patients coming in and they're like, I know something is wrong. I've been told that it's in my head, it's all anxiety. But once you get to monitor them with long-term monitoring, long-term Holters, um, we do find that they have abnormal rhythms. So yes, with the change in the balance of hormones in the postmenopausal phase, we do see different arrhythmias that occur.
After menopause.
Yes.
Okay, great. There's a couple more questions, but I'm going to get into just a couple more questions from our audience. But there was a couple of things I wanted to address with you. So let's say there's been a diagnosis of a mental health disorder or a cardiovascular disease. There's lots of wearables out there, lots of sort of great tools to monitor health. Some are easier to use than others. Some have oversight from physicians, some don't. Some provide access, periodically to do telehealth visits and have discussions. So when it comes to either a mental health disorder that's being treated pharmacologically or a cardiovascular disease, and a physician decides, you want to take it upon yourself to take more control and monitor and measure your heart over time. Can you discuss sort of maybe beyond just a watch, a single lead, or maybe that's good for some, but the integration and how to use your own personal ECGs in addition to the advice that you're giving to a physician to monitor your heart and either the progression of heart disease or the impact of the medications. Like, are
Yeah.
there certain intervals? Like, what kinds of devices? Like, maybe you can just talk about
Yeah.
that.
Yeah. I certainly think that portable EKGs, right, the 12 lead EKGs are very, very invaluable, and they do provide valuable insight into sort of the physiologic effect on just a disease condition, but also stress and anxiety and depression and how it interplays with the heart. And so, individuals who have a portable EKG can certainly identify the stress that's that trigger for how they're feeling. So, if they're in a specific situation or instance, using that EKG can give them immediate feedback in terms of what their underlying rhythm is in that particular situation. So that will cause more of, or that will result more in an acceptance that, okay, this is not an abnormal heart rhythm, just a normal rhythm, a little fast because I'm stressed. So that immediate feedback, I think, certainly causes relief with some individuals. I do think that having a 12 lead EKG that the individual wears and gets that information sent to a provider that is skilled or adept at interpreting the information is a win-win for everyone, right? You're getting immediate review of your underlying rhythm, but you have certainly an expert that can read the EKG and give you some peace of mind. Just being more proactive in one's healthcare, I think, is certainly invaluable, and a 12 lead EKG certainly does that.
Yeah, thank you. Yeah, we've seen that with our members, and we've done surveys and we've done interviews, that just being, wherever you are and whenever you want to take a look at your heart and have a provider look at it, brings that peace of mind, because most of the EKGs we see certainly are normal, right? I mean,
Right.
but what's fascinating is that 90% of all ER visits with complaints of chest pain are not cardiac related. But if you're sitting at home and you're having, you know, chest pressure, palpitations, butterflies, nausea, sweating, and you're not sure whether you should go to the doctor or not, having that at home and then having a provider look at that and tell you whether
Almost
or not.
immediately. Yes. Yes.
We're seeing people really appreciate that service. It's not an easy service to provide, a live person within 30 minutes, but that's our mission here, is to provide that peace of mind with, enabling the early action, from that's given by an EKG and a provider at the other end of it. So I'm going to move over we only got about 7 minutes left. There's a few more questions here coming in from our audience, and then we can wrap it up. So with the increasing prevalence of burnout, career burnout, maybe child burnout, how do we mitigate the risks of cardiovascular disease that can arise from the stress and anxiety and the depression that comes from I'm just burnt out?
Fair question, because I thought I was there a couple of years ago.
Yeah.
Use your voice, right? So certainly reach out. We talked about discussing it with your healthcare provider. And it's not that every road leads to pharmacotherapy, right? You don't have to get on medication, but certainly just to have the diagnosis identified. It could be burnout, but it could be depression, but it really could just be burnout and not really a diagnosis of depression. So speaking to or reaching out to a provider who is aware of the situation certainly would be helpful. My other thing would be keep connected. Make sure you have that social circle that you can fall back on. There are many people who are experiencing the same thing as you, and you may just not know because nobody wants to talk about it. But keep connected. Do not be socially isolated. Certainly have routine and regular follow-ups, especially if we're talking about medications, right? We want to make sure the dose is appropriate and the dose is not going to cause harm. I would also say try to find that work-life balance. And again, it comes into whether we're doing exercises like yoga or Pilates or mindful breathing, cognitive behavioral therapy. There are many options out there that are certainly inexpensive, right? If we look at all that's available, there are lots that are very inexpensive that we can utilize to help mitigate this burnout.
Yeah. I think we all sort of have, I don't care who you are, what field you're in, you can feel it can be overwhelming sometimes. And that overwhelming feeling is, as we're discussing today, can have major impacts on your heart and your overall health. We have another question that came in. I have PSD, and I've been told that my racing heart is coming from my PTSD, but it's waking me up at night with anxiety. What do I do? How do I do that? What do I do to manage the fact that someone's telling me I have a racing heart because I have PTSD? The racing heart is the anxiety. It's a byproduct from the anxiety, which is a byproduct of the PTSD. Again, how do I manage my racing heart that's waking me up in the middle of the night?
Right. That could be true. For me, a mental health condition is always a diagnosis of exclusion. So, before I say it's a PTSD, I certainly would recommend that that be evaluated, right? There are lots of arrhythmias that's not related to PTSD that do awaken individuals at night. So number one, I would reach out to a provider and make sure it's not an organic issue. It's not AFib, it's not SVT, it's could just be a regular rhythm that's fast, sinus tachycardia, but that should always be a diagnosis of exclusion. And then the other thing would, of course, be to seek help with regards to the PTSD. That's going to be the number two thing that you can do, because, or maybe number one, actually, I think they go hand in hand. It's parallel and not in series. So there are many practices that's out there. Certainly talk to somebody who is adept and more of an expert in that field. So cognitive behavioral therapy, psychotherapy, counseling, et cetera, just to get to the root of where the PTSD is coming from. But I certainly would recommend at least having an ambulatory or heart monitor just to exclude an abnormal rhythm.
Yeah, that makes sense. Maybe a continuous monitor patch or something like that over a period of time.
Correct.
Well, this has been fantastic, Dr. Frazier. I really appreciate your willingness to come on and have this discussion with us. I think we've learned a lot today about the interplay between stress and mental health and anxiety and anger, and its impact and driver of cardiovascular disease and arrhythmias. I don't know if there's anything left, any questions left that I have, but I don't know if there's anything that you'd like to say before we say goodbye to the audience.
Just to reiterate that the two conditions are bidirectional. One makes the other worse, and the corollary is one makes the other better. So don't suffer in silence. There are therapies, whether it is pharmacotherapy or medications versus non-pharmacologic approach to either or. This brings me to a study from a group at OSU, Ohio State University, just a couple months ago, that they found a 75% reduction in individuals coming in with cardiovascular conditions who've had or who've been treated with anxiety and depression. And they found that there is a decrease in morbidity and mortality. And that probably is the first study that have shown such an impact of mental health on cardiovascular disease. So lots of studies that still need to be done, lots of information that's out there. I would recommend that our viewers arm themselves with knowledge. So go out, explore, read, and take some autonomy in your overall healthcare.
Yeah, I really appreciate those thoughts and that sentiment, because there are lots of ways to take control, whether you live alone, whether or not you have family, no matter what your age, and there's a lot of different ways to get help. I'd be remiss at SmartHeart. We think this is a gap that we're filling here by linking people with either mental health and anxiety that need the peace of mind, that those palpitations and that shortness of breath and that fatigue, and the gut feeling that something's wrong, that you can be empowered to take control whenever you're feeling like that, to have a provider take the most comprehensive view of your heart and tell you whether or not that in that moment, what you're feeling, is your heart okay? This is certainly only one test. It's not meant to be the most comprehensive. Doing that, in a physician's office or over a telehealth visit through a discussion about all of the different, tests, because it's usually not one test that's going to find an arrhythmia, and how to treat it. It takes usually a battery of tests and questions and answers, but certainly that is a gap we're trying to fill here, is connecting a hospital grade device like a 12-lead EKG with a board-certified U.S. cardiologist like yourself, who can not only help manage the arrhythmias and the disorders and the cardiovascular diseases, but is also concerned with your mental health, because people like you, Dr. Frazier, understand the interplay between mental health and cardiovascular disease. And if you're seeing a cardiologist that doesn't understand that, you're seeing it here, that the SmartHeart cardiologists want to take care and understand that relationship. So we're really grateful for you being here. Looking forward to doing the next one. If there's any additional questions and answers, feel free. There's a chat on our website. You can throw them into the chat at getsmartheart.com, and we'll get back to you as soon as we can. But until next time, have a great weekend and stay healthy.